Hello everyone, my name is Oleksandr Pearsall, and welcome to this short presentation on the importance of sleep quality and health for Dr. Jenny's Intro to Health Education course. Let's go over what we hope to learn in this presentation. We will discuss the basics of why people sleep. We will discuss the quality of sleep and why it's important, especially in a time of social distancing and COVID-19. We will learn some of the risks of sleep deprivation or poor sleep quality. And we will learn how one can improve their own sleep quality to get a better night's rest. Let's get on to the question of why we sleep. The short answer to this question is that no one knows for sure. The question of why people sleep has been debated about and argued for millennia at this point. And there's been hundreds of theories and speculations argued about and even put into practice at some times. But they all agree, every single theory agrees, that sleep is a basic human need. Like eating, like drinking, like breathing in oxygen, sleep cannot be avoided. The body will go to sleep eventually. So, what is the current theory of why we sleep? Well, that is the theory of consolidation and recovery, two theories I sourced from the Sleeping Foundation and the National Institute of Health. And this is a combination of two previous theories. The theory of consolidation, which is the theory that your brain is retaining memories, retaining information as you sleep and processing them, and the theory of recovery, the theory that your body's cells are being rebalanced, repairing themselves, preparing themselves for the next day. And it's all being regulated by an internal body clock. This is the nature of how you sleep, more or less. It is the feeling that you get when you go to sleep at night. It is the feeling that makes you want to wake up in the morning. This is what controls sleep as we know it. So, now that we know the basics, how much sleep do we need? Well, according to this chart created by the National Heart, Lung, and Blood Institute, it varies depending on your age. Adults need 7 to 8 hours a day. Teenagers need 8 to 10, while infants need 12 to 16, and it all varies from there. Now that we discussed the basics of sleep and how much we need to sleep, let us talk about the general benefits of sleep, or a good night's rest. A good night's rest has a bunch of different benefits, such as improved mental health, makes you less stressed, makes you less anxious, allows you to be less irritable, more approachable in the morning, allows you to feel refreshed and re-energized. This is due to the theory of constellation, where your brain is already mentally refreshed due to the fact that your hormones and chemicals in your brain are balanced and ready to go in the morning. It improves your mental health. This comes from the theory of body recovery, allowing your cells to grow and develop as you sleep. Waking up in the morning allows you to proceed in weight management easier, allows you to feel energized, allows you to have less drowsy spells throughout the day. It improves your quality of life. Social health, you're not as mopey, you're not as irritable, you're not as difficult to approach. You're a lot more approachable after a good night's rest. Safety. Having less drowsy spells, being less anxious, being less stressed allows you to improve your workload, your work capacity, allowing you to do everything you need to do in the morning better. Proper sleep health is also the best prevention of sleep deprivation and deficiency. Now, what is sleep deprivation and deficiency? Well, most people think it's the same thing and the terms are just interchangeable, but they're not. They're two different things. Sleep deficiency is a concept. It is defined as losing 1 or 2 nights of sleep and then feeling drowsy and drained in the morning, while sleep deprivation is a condition. It is the act of losing weeks upon months of sleep and not being able to wake up in the morning, not being able to go to sleep until your body decides to, and feeling the full force of not having enough sleep. It's an extremely common problem in the US, with around 20% of Americans not getting enough sleep, according to the National Heart, Lung, and Blood Institute, giving them a form of sleep deprivation or deficiency. Some risks of chronic sleep deprivation: stress, intense drowsiness, heart disease, high blood pressure, kidney disease. Since it is a condition of the mind, a lot of the symptoms and risks will crop up from around the body. An extreme risk that I discovered was the risk of brain cell degeneration. According to the Journal of Neuroscience and the researchers that conducted this study in 2013, there is a 1-to-1 direct comparison between sleep deprivation and the degeneration of specific brain cells that control memory and cognitive functions. Some risks are far more common than others. Just because you have chronic sleep deprivation does not mean that you're going to have heart disease or brain cell degeneration. You're just at risk for them. Instead, you'll most likely get drowsiness, lack of energy, problems with mental capacity, and overall irritability. According to the National Heart, Lung, and Blood Institute, deficiency is not deprivation, but it can lead to it. And a person cannot just recover from deprivation from just a few good nights of sleep. They need medicine, they need therapy at this point, they need a lot of things. Now I'm going to do a quick assessment check to make sure the information is retaining. Feel free to pause the video to answer the questions. True or false? Sleep is not a basic human need and can be avoided. False. Sleep is 100% a basic human need and cannot be avoided. What is the difference between sleep deprivation and sleep deficiency? Sleep deficiency is the concept of losing 1 or 2 nights of sleep, while sleep deprivation is the medical condition allowing for weeks of sleep and months of sleep to be missed. True or false? Sleep can improve aspects of mental health. True. Sleep can 100% improve your mental health, making you less stressed, less anxious, and more approachable. Proper sleep is the best prevention against what? Sleep deprivation and deficiency. True or false? 50% of Americans do not get enough sleep. False. This number is way too high. Only 20% of Americans don't get the required amount of sleep. Now that we discussed the benefits of a good night's rest and the risks that you get for being sleep deprived, let us talk about how COVID-19 and social distancing affect sleep quality. The pandemic affects sleep in many different ways. Most people are getting more sleep due to the fact that they're at home most of the time, but some people are having a negative effect against it and having less sleep and getting more risk of sleep deprivation. We're going to focus on the negative effects. The general problem is the same as before: sleep deprivation and deficiency. In what way does COVID-19 change the way people sleep? Well, to answer that question, we're going to have to look at two different aspects: the work and education aspect. The first aspect is the work front. Now, workers in the era of COVID-19 can be separated into two different classes: those that are laid off or have lower hours, or those that have more hours thanks to COVID-19. Let's talk about those that are laid off first. Now, those that are being laid off are staying at home more often, but their waking and resting cycles are still the exact same. They're waking up at the specific times that they used to when they had to go to work at normal hours. This makes it a lot more difficult to stay awake at night. It gives them stress, anxiety. When they wake up in the morning, they don't know what to do with themselves. They're just walking around mainly, and then they can't go to sleep unless it's a specific time. Meanwhile, those that are, say, medical workers or those on the forefront of COVID-19 are getting more hours, making them have less time for actual sleep, making them more anxious, making them more stressed, and overall lowering their quality of work. And the primary cause of all these problems? Changes in schedule. The changes in schedule are the only things that are throwing them off and the only things that are aiding to sleep deprivation. Now let's discuss the student education aspect of all this. The problem is more or less the same. Schedule changes, but in this case, the schedules are no longer in place. This means that students have a myriad of different things to do. For young children, that means more screen time, staying up later, playing video games, talking with friends, and ruining their sleep health in general. While high schoolers and college students have the same problem: more screen time, staying up later, but they have the lovely advent of online assignments, making them put off assignments, making them procrastinate, lose focus more, and then having to stay up late hours of the night focusing on cramming one assignment or studying for one test, ruining their sleep health. For college students especially, they need sleep to succeed. According to an article from the Journal of American College Health in 2011, college students are expected to get at least the full 8 hours to fully succeed. To understand this better, refer to the previous National Heart, Lung, and Blood Institute chart, showing how many hours a day you need of sleep. For adults, it's 7 to 8 always. Now that we talked about the negative effects that COVID-19 and social distancing has on sleep quality, how does one improve it, or how does one recommend improvements? Well, you must first begin with getting used to and creating a new schedule. Since COVID-19 isn't going away for a while, one can only get used to the new work schedule they have. Though it's difficult, it is the first step. Add an hour or two of quiet time right before bed. Sit in total darkness, leave yourself to your thoughts, just don't use a phone or turn on any lights or do any physical activity right beforehand. Avoid non-essential screen time right before bed, at least 4 hours before bed to avoid any non-essential screen time. Avoid large meals before bed. Due to the fact that your body's digesting and adding in more carbs and sugars, your brain will stay awake for longer. Avoid caffeine, nicotine, and other stimulants. This is a given. Add naps or shorten them to your schedule. If you are not taking naps during the day, add a 30-minute nap randomly throughout the day so that you can easily improve your sleep quality. Or shorten them if you are taking hour-long naps or 30-minute naps. Keep a quiet sleep environment. Make sure that your bedroom is dark, quiet, and serene. And use health management apps. I know this directly contradicts the non-essential screen time thing, but health management apps do help out with sleep quality. If you remember to the previous health management app assignments, there was a specific health app called Headspace that helps out with sleep health quality. And there are plenty of different standard apps that come with iOS and Android that helps out with this as well. Now that we've gone over everything, let's have one last assessment to see if any information is stuck. What is the current theory of why people sleep? The theory of consolation and recovery. True or false? You should have a large meal before bed to improve sleep quality. False. Large meals should be avoided as it will keep you awake for longer. What is sleep deficiency? The act of losing 1 to 2 nights of sleep and feeling drowsy and drained in the morning. True or false? All screen time should be avoided. False. Only non-essential screen time should be avoided. Name one physical health problem one can receive from not enough sleep. High blood pressure, heart disease, any kind of stress management, hormonal issues, degenerative brain tissue, etc. This concludes the short presentation. If you had any questions or are confused about anything, then I highly recommend you look at some of these links or some of these journal articles. The Sleep Foundation and the National Heart, Lung, and Blood Institute are the primary sources that I've taken from, and the two journal articles are not bad reads either. They are actually extremely interesting. Thank you.